I'm Dr. Sandra Laura Kramers, and today I want to talk to you about something called narrow angle. This is a picture of a normal eye, and this is the front surface of the eye called the cornea. This is the iris, the colored part of the eye, and together they form an angle, kind of like this. It's usually about 34 degrees or more, and at the base of that angle is the drain of the eye, which keeps the pressure of the eye stable and tries to avoid fluctuations. The pressure is very important in maintaining the health of the nerve. If the pressure fluctuates or goes above 21 millimeters of mercury, it can cause permanent damage to the nerve called glaucoma, which can then lead to blindness. So narrow angle is very important in picking up because it can lead to something called an acute attack of glaucoma. So this is an example of a normal eye, and this is an example of a patient who has a narrow angle. Here's the cornea, here's the colored part of the iris, and you can see that the angle of the eye is extremely narrow. When we look at the parameters on this test called the pentacam that actually shows us the actual eye and the angle, we know after many studies that have been published in the literature, the normal volume is more than 171 cubic millimeters. This patient has 74, which we know is very, very decreased. If it's less than 100, we know that there's an increased risk of something called acute angle closure glaucoma. So we look at these parameters, something called the ACD, which is the anterior chamber depth. Usually it's more than 2.5 millimeters, and his is 1.95. If somebody's less than 2.0, they also have an increased risk of angle closure. So these are some of the parameters, and this one is the angle, which usually is more than 34 degrees. He's 21. So these are the risks. So we give patients something called a narrow angle sheet, and it goes through what the normal is. Volume, usually more than 171. The ACD is usually more than 3.15. If it's less than 2.5, we know it's a patient with a narrow angle. This is the definition, less than 113 cubic millimeters of the volume, less than 2.5 depth, and less than 34 degrees. So this is what narrow angle is. Now, if you have other parameters, which this patient has, you have a higher risk of angle closure glaucoma, and that's what we try to prevent. So this sheet has all the options of how we treat this and what we need to do if you achieve those risk parameters. So generally what we'll recommend if you are at high risk is something called a laser iridotomy, and what that is a laser that creates a little small microscopic hole, usually under the eyelid, and basically what it does is it allows the fluid that's produced here to take a shortcut and allows the fluid flow to open the angle. Usually the fluid has to go all the way around the pupil and then it goes into the angle, but in this patient the angle is narrow and it actually causes sometimes a risk that the angle will close with time. The reason for that is the lens. This is the lens of the eye. With everybody, the lens gets thicker, a cataract can start to form, or genetics can be another risk for narrow angle, another cause of narrow angle. So laser iridotomy is the best way to take care of this. In the past, we actually had to go into the operating room, open the eye, and take out a piece of the iris. Now with new lasers, we don't need to do that. So I highly recommend in all my patients that if they have a high risk of angle closure glaucoma, they have the laser procedure. The laser procedure is very quick, usually takes a couple of minutes. The risks of the laser are extremely rare. The risk of damage to the lens or damage to the retina is very, very rare. The most common risk that can happen after the laser is the hole can close, which we just touch up and reopen. It takes only a few minutes usually. Sometimes there's a little bit of a pressure increase and we give some drops to help with that. And the biggest risk of everything is not doing anything, because this can lead to angle closure glaucoma. The symptoms of that are usually a headache, especially in the evening when the pupil is dilating, pain here, vision loss, and then the vision starts to get worse. So if that ever happens to patients, I recommend an acute visit to us here or their local IMD. I also tell patients to avoid anything like Benadryl or drops or drugs that say do not take if you have narrow angle glaucoma or if you have glaucoma, such as anti-anxiety drops, some antidepressants, so read the labels. If you have any questions, please email me. My email is drkramers@visionareyeyedoctors.com. Thank you.